sorry for my issues. It's been a day, but I see some familiar names on our attendees, so good to see you guys for another Practice Partner Academy. We are going to get this show on the road, so our lead instructor today is Bree Wright. Bree is a registered nurse and a nursing instructor who has been actively practicing foot care for 22 years. She practices, Saskatchewan is one of the hardest words to say here. So the fact that I just did it with my blood pressure like boiling.
It was well done.
Yes, I'm proud of myself. So,
what's the name of the town?
Moose Jaw. That one's easy.
Yes, it is a place.
I
What's
told
the
somebody about it
tonight?
the other day, and they had actually heard of it, and I was like, wow.
They had?
So,
I'm sorry.
yeah.
I mean, of course they had.
There was a weird reason why. I'll try to remember what the reason was. But Bree sits on the executive committee of the Canadian Association of Foot Care Nurses, and she was also part of the pioneer group of the profession who got the opportunity to go to Germany to be just frontline trained on Poto Expert. Kind of, I guess, not from the horse's mouth is not the right phrase, but just I guess we'll just use the word pioneer. So we're very lucky to have Bree with us. And David Zuckerman is, who doesn't know David? If you've been in podiatry for any amount of time, you've probably seen David out and about, whether it be at trade shows or on YouTube. But David is also a pioneer in podiatry technology, and he is very well known for bringing innovative products to the podiatry space. Most notably shockwave therapy and class 4 laser therapy. So Poto Expert is to have those types of technologies and then have David bring Poto Expert to the United States, just I think kind of showcases the fact that it is extremely innovative. And even though it's just in a little can, the liquid or the foam that comes out, I don't even want to call it liquid because it's not, but the material that comes out is
it's a moose.
It doesn't see it blows your mind with the results, but yes, it is actually.
Oh, I just forgot. You're a user. I forgot you're a user.
Yes, I do use it. I'm obsessed with it. So I love that you're an innovator of these products for podiatry in the United States, and that this has become one of your products in the line. So I'm very, very excited to have both of you here tonight for Practice Partner Academy.
Yeah, I will make one comment. You can have a great product, but you have to have good education. And that's where Bree Wright is. She's an expert in this. So please listen tonight. You'll learn a lot. If you ever have a question, Bree can always answer it, whether it's after the seminar or webinar or just emailing her.
Right. Yeah, and we'll provide that information at the end of the session. So I'm going to try to make my computer be better while I'm in the background here, and I'm going to hide myself and let you guys get to it.
All right. So I'm still here. Bree, go ahead and share your screen. All right, you are good. So I'm going to turn it over to you guys. And while you guys are presenting, I'm going to mute myself and turn off my camera so that I'm not a distraction. But I am sitting here, and just a reminder to our attendees, type in your questions in the Q&A or the chat as they occur to you, and we'll get them all answered for you. All right, and with that, y'all take it away.
Well, thank you everyone so much for coming and listening. I really, I am a nurse and nursing instructor, and I'm frequently asked to vet certain products to see if they'll benefit my practice in any way. And I have to tell you that when I went to Germany, Poto Expert has changed everything. It has changed so much. I'm going to show you before and after pictures that are absolutely going to blow your mind. This product is just so amazing. So I want to explain. Poto Expert is different than anything else on the market. Right now, all lotions really can do is moisturize the skin. And if you look at the definition of moisturizing, that really means that it only alleviates the symptoms of dry skin. It doesn't actually repair the cause of it. The actual cause of the dryness to the skin is a lack of hydration or lipids, whose job it is to keep that protective layer of the skin wall sealed. So how do we explain this to our patients? At the end of the day, this is what it comes down to, being able to speak to them and tell them why Poto Expert is so different. There's nothing like it in the world. Picture your skin. This is what I tell them. Picture your skin and its many layers like a brick wall. The purpose of that brick wall is to keep certain things like bacteria and germs out, keep in other things like water and moisture, yet still allow oxygen to pass freely throughout. In this scenario, your skin cells would be the bricks, but it's your lipids, your fats, triglycerides, your cholesterols that form that liquid mortar that fills the gaps between those bricks and makes for a solid surface for protection. Fortunately, as we age, our bodies simply can't keep up with the constant damage being done to our skin. Factors are constantly breaking it down. Anything from biological aging, UV processes, diseases, poor nutrition, smoking, the list goes on. And these factors cause the mortar of our brick wall, the lipids, to become depleted and cracks start to form. And it's these cracks in that protective wall of the skin that lead to dryness and then other dermatological issues. And this is what makes Poto Expert so exciting. Neuberg has actually developed skin equivalent lipids and can deliver them in a way topically that is bioavailable to the skin and has been clinically proven to induce actual skin repair in 30 days. One can of Poto Expert will last your patients at least 6 weeks if they're using it on their feet and lower limbs. They're not going to. They're going to start using it from here down every day because it feels absolutely glorious. But this product, it's not like you're asking your patients to invest. You're saying one bottle. I tell my patients, buy one bottle, give it a try, use it twice a day as it's supposed to repair the skin barrier. And if I'm wrong, you're out $30. If I'm right, it's going to change everything for you. And it does. I'm excited to show you some pictures. The Poto Expert products are so unique in that they contain 2 secret sauces. The first is the Lipo2 skin repair technology, which is comprised of lipids that mimic those naturally found in the skin. These are called biomimetic, which means that they are shaped the same way as the natural lipids in our bodies and thus able to fit properly into the holes in the wall of the stratum corneum, which is that protective layer of skin. So these lipids, when delivered properly, fill in the lipid lamellar bilayer and actually cause a reorganization of the stratum corneum, and it causes all of the gaps to close in that protective layer. The catch is that in order for these lipids to do their work, they have to get to all the many layers of that brick wall. And this is where the second ingredient comes into play, and that is the Barrio Expert foam technology. This is a unique delivery system. This foam technology has the ability to deliver the Lipo2 lipids in a way that lotions cannot. It doesn't sit like a barrier on top of your skin like lotions do, often blocking the skin's pores or occluding the skin's breathability. Instead, it takes those lipids and soaks them deep into the stratum corneum while still allowing the skin to breathe. So together, when you have that Lipo2 skin repair technology and the Barrio Expert foam technology, it closes the gaps in that damaged outer lipid matrix and provides the skin with the optimal natural environment for the skin to thrive. So a double-blind, randomized, placebo-controlled clinical study, which we know is the pharmaceutical gold standard testing for unbiased results, was conducted and published to assess if the Poto Expert products actually do what they say they do: restore a healthy skin barrier in just 4 weeks. Well, as part of the study, they tested the damaged skin to assess the lipid profiles found both before and after 4 weeks of using the Poto Expert twice a day to see if there was a change in the quality and quantity of lipids in the skin. They tested transepidermal water loss, skin hydration, and the length of the lipids. And that's really important because under a microscope, lipids are very short and uneven when the skin is unhealthy, but they are longer and linear when they're in prime condition for creating a proper barrier for the skin. So those results showed that after 4 weeks of using the Poto Expert products twice a day, they actually found the presence of the lipids from the Poto Expert foam cream in the skin sample that was not found in the sample prior to the 30-day treatment, which is exciting enough. It proves bioavailability. That's incredible. But they also found significantly reduced skin dryness, increased flexibility of the skin, and a 3-fold increase in the number of lipid lamellae that were shown under a microscope. You could actually see, those of us that went were actually looking under the microscope to show that the lipids have increased significantly in length and health. It's so significant because it proves the Poto Expert has put the skin into such a healthy state that the body starts to regenerate on its own. It's not that the Poto Expert is causing regeneration. It gives the skin the optimal environment to allow the body's own protective systems to wake up, and leads to the synthesis, sorry, I can't find my words tonight, synthesis of different lipids, which is so important for self-regeneration. And it's also very important to note that the same study was carried out on diabetic skin with almost identical results. Repair of the skin barrier in just 4 weeks with the induction of self-regeneration. Are there any questions I can answer before I move on? Just take a moment.
We're excited about the pictures.
I'm going to show you the pictures. Here we go. This is 1 month. 1 month, twice a day. We've got different products. I'll go into them. 1 month. This was a student, a nursing, well, not a student. She was a nurse. She was taking the advanced nursing foot care course. This was her daughter, an 8-year-old, no other interventions, 1 month. This was at 2 weeks. This was done by Dr. Andrew Springer here in Canada. He was doing a clinical review of severely dry, cracked skin on patients with diabetes. So this was 38 days. This patient wasn't even compliant with using the Poto Expert twice a day. And you can see such a substantial difference.
This one's amazing.
Yep. The Palmer hyperkeratosis. This poor gentleman suffered so much. And yes, people ask, can you use Poto Expert in other parts of the body? Of course, skin is skin. I personally do use it from here down every day. And most of my patients, when they purchase it, end up coming back and having to purchase more because their wives or their daughters or someone has found out how wonderful it feels and is now stealing it.
Hey, can I mention something real quick? Or you want to wait till after the pictures? Because there's, I mean, I had a difficulty until I saw the electron microscope, because we're all taught in podiatry, urea, moisturizing. There's no product like this that repairs. This is not, it has a moisture, what's it, about 8% urea in it?
This specific product, there's 8% urea.
I'll
go through
this
that.
is, you know, this is a repair and a moisturizer. It's repair. And I've never seen anything like it in my life.
I haven't either. And that's why I'm so passionate about it. I see the difference. A lot of these pictures coming up are from my own patients. This was 2 weeks. Your patients, if they're using it twice a day, will notice a difference very, very quickly. This is a patient of mine. 1 month, twice a day. Oh, they get better. This is a 15-year-old with eczema using the non-urea formula.
Why do you non-urea?
Well, I'll go into it when we get to the we need to have a non-urea formula because some people are allergic to urea. Some people have sensitivities. Children tend to respond or react to urea. So anytime I'm dealing with a child under the age of 5 or 6, I'll usually start them on the non-urea formula. Urea can also cause excessive thinning of the skin. So if you have a severe diabetic patient, perhaps you want to start with the non-urea formula. This was 1 month. This gentleman, he I think he was 92, was not a patient of mine, just showed up at my clinic. I happened to be out talking with reception, and he came in and he just said, you know, I really need to see the foot care nurse. And, you know, my next patient was there. I didn't really have a lot of time to see him. I said, you know what, I can look. So my patient was being very kind about it. I can look. This is what I saw. Initially, and I said to him, I was like, I do think that you need to speak to your physician. You might need to see a dermatologist. I said, once you figure it out, I gave him a bottle of the dry, red, and itchy skin. Once you figure it out, try using this. He showed up 1 month later, same thing. I just happened to be out front, and he said, I have to show you what your lotion did. He didn't go to the doctor. This was all the Poto Expert 1 month later.
What do you think that was on the left?
Oh, your guess is as good as mine. It's extremely irritated.
Was it itchy? It was very itchy.
I don't think so. He didn't suggest that it was itchy, but as we'll talk about, the dry, reddening, itchy skin formulation has a little secret ingredient called pyroxenolamine, which has significant antifungal and antibacterial properties to it. And I think there was just some sort of significant inflammation. I think the pyroxenolamine helped.
Yeah.
I've seen so many, even minor wounds, people will get spider bites and cuts. And of course, we don't tell people to use an over-the-counter product on skin, but they do, and the pictures that they have are phenomenal. This is also a patient of mine. He was going through chemotherapy. This is within 1 month.
That's phenomenal.
Mm-hmm. This is another gentleman. He came in and he couldn't afford anything, and he just said, do you know of anything that can help? And I said, you know what? I don't know. Photo experts never let me down. I said, I'm going to give you a bottle, take a picture before and after, and let's see what it does. That's 1 month. I saw these patients with my own eyes. I took these pictures.
Yeah, we're using all these products with the Remy laser now for the combination of warts, fungus. It's phenomenal.
Well, and David, maybe you should speak to the fact that, like, let's talk about that. If the patient is using Photo Expert on a regular basis, that skin barrier is going to be so much healthier. They're going to be far less prone to things like warts because the skin isn't going to be open.
Well, we use it post-wart treatment, in combination with the Healthy Nails, that's a phenomenal product. Phenomenal.
All of these are podiatrists that you're seeing here. Podiatrists are sending in these photos because this is what they're seeing. So the Healthy Nails spray also has that pyroxenolamine in it, and we are just seeing phenomenal results when used in conjunction when you're treating an onychomycosis. So, if you're using the Remy laser, for instance, for the treatment of onychomycosis, implementing the Healthy Nails tincture spray twice a day, that active use of the pyroxenolamine. It also has panthenol. It has a nail infusion system that mineralizes the nail. And even if you don't have an onychomycosis, even some patients that have woody nails will put this on, and it really strengthens, and your patients will get that healthier looking nail faster. In addition to getting the results faster, using it prophylactically once you're done treatments. Patients who tend to have onychomycosis tend to reinfect themselves down the road. And so using the Photo Expert on a regular basis, the Healthy Nails, is a great way to prevent future reinfection. Amazing. So, unique features of the Photo Expert products. It is unique and patented technology. The Lipo2 technology and the Barrier Expert foam technology is patented. Some patients will be like, oh yeah, I think I saw something like that. You didn't, because there's nothing else available that has the Lipo2 patented technology. There's other foam creams, of course. Neuberg was the original inventor of the foam, of that Barrier Expert technology. It's been adopted by another brand or two, but they do not have the Lipo2 technology. They do not have the clinical studies to back it up. And these are not aesthetic clinical studies. These are actual pharmaceutical level clinical studies. And I'm sure Sarah would be happy to share those clinical studies in the chat. It's extremely fast absorbing and non-greasy. So for those patients who have compression stockings, it's really hard once you put lotion on them. And they're the patients that need the lotion the most. They're suffering from chronic venous insufficiency. Their skin is dry, it's itchy. You take off those compression stockings and it's like the skin goes poof. You can put Photo Expert on and it sinks into the skin so fast. You can snap like that as soon as you put it on. It just soaks in. It's fantastic. It has a significantly higher yield. So David and I, once a month, we put on a question and answer period for North America for the Photo Expert products. And we wanted to know, we always get asked just how much product is in that 125 ml bottle. Our Canadian, another educator that came to Germany with me, Tom Pfizer, we did a special where we tried to figure out just how much product is in this foam, because it just keeps coming and coming and coming. There's so much product. So we took he took 2 beakers, Tom, and he took a 125 ml bottle of lotion and filled it up. And so there was about that much lotion. He then took the Photo Expert foam and filled and filled and filled. It filled 4 liters of beaker. There's so much product in this. It's substantial. However, the most exciting thing about Poto Expert that I can possibly, prepare yourself because you're going to gasp and shock, is that not only can it, but it should be used between the toes.
Maceration.
Seriously, how many times do we tell our patients, myself as a foot care nurse for 23 years now, actually, as a nursing instructor, how many times have I said in my life, do not put lotion between the toes. It leads to maceration, malformations. It just breakdown of the skin. You never do it. We all know this. We all teach our patients this. It was so hard for me that first time when I saw some maceration between the toes to tell my patients to use this. And you have to wrap your head around this. This isn't a lotion. It's going to give the skin something it needs to repair itself. It's going to help the skin. We have to rethink how we think. We cannot lump it in with other lotions. And I tell you, it's sure not hard for me anymore, because when those patients came back to me after a month, the repair to the maceration and sometimes even small openings to the webbing between the toes was so phenomenal. It's fantastic. And right now we don't have anything that we can really do. We tell our patients, separate it, use rubbing alcohol, blah, da, 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 dry really well. We can give our patients, but we can't give them anything that actually works. And this works. It works so well. You will absolutely love it. Again, it's 1 month, 1 bottle. Try it. You can order 1 bottle from ZFT. It's absolutely phenomenal what this product will do. You have to use it right. You have to educate your patients that for that first bottle, they need to use it twice a day so that you can get those lipids and repair that skin barrier. People will often ask, do I need to keep using it twice a day? That's kind of, it's inconvenient for some people. It depends. Most of my patients can go, after using 1 full bottle twice a day, repair that skin barrier. They can then go down to once a day. It all depends on how many risk factors you have, how dry your skin is. Are you living in Nunavut? I don't know if you know where that is. It's the Arctic Circle. It'd be much drier. You'd want to use it a little bit more often. But most of my patients typically can then go down to where they're just putting it on before bed and they maintain that skin barrier. It's such a phenomenal product. I cannot be more passionate about it. So I'm going to explain to you very quickly, unless there's any questions, the Poto Expert line. So look at these. Other questions?
Well, I was just going to say, if you would like, we've got not a humongous crew on tonight. So if you'd like, everyone's muted. I can allow everyone to talk. Do you want me to go ahead and open everyone's mics up?
Yeah, that'd be great.
Awesome. All right. So if you're online, well, if you're not online, you can't hear me. So everyone, I am opening up your mic. So if you want to ask a question without typing it, feel free. You just have to also unmute yourself. So I have unmuted you as the organizer, but you can unmute yourself if you have a question that you'd like to speak over your microphone. You can also use the question box at the bottom of your screen. If you feel more comfortable typing a question, I will see those as well, and I can pass those through to Bree and David. But I know Bravid. I just gave you guys like your celebrity.
Oh, David, it's happening.
So Dree and Bravid, you can ask them over your microphone, but I know they love to hear your voices. So if you prefer to do it that way, that's also encouraged. I was going to say though, Bree, when you right before you started talking about Tom doing the test of how much liquid was in there, the very first time I tried the product was just the sample bottle. So it was like, what is that, like 5 milliliters?
It's 15 mils, and it will last for 2 weeks. You have to be careful how many you give out, because they'll never need to purchase it from you.
Seriously, I was just like, it was the tiniest bottle that I'd ever seen. It was like super cute. It was like a little Barbie bottle.
I love to give those out to my patients at Christmas time because they just fit right into your purse. And honestly, during COVID, Neuberg was so generous. They donated hundreds of cans to our local like RCMP nurses, emergency rooms, because you're washing your hands so often. And when you put the Poto Expert on, it seals that barrier, and you can still put your gloves on right away. So
that was the thing too, when David had mentioned urea, because obviously I've had experience with urea creams, and the higher the percentage, the more, I guess chalkier is a good term, I guess, to say, but I hate getting that on my hands. I hate it when it's on my hands. It feels
It has
awful.
a film. Yeah, it has a
Yes.
film.
And when I got the Poto Expert on my hands, it didn't bother me at all. I mean, I still wash my hands just cause, but like I didn't feel the immediate urge to run to the bathroom and wash my hands.
Yeah, it's a great formulation. So just to help people, because one of the most common questions I get is, how do I know what product to start my patients off on? And Zuckerman Future Technologies does have a great starter pack. It's got a variety of all the different things that you can try, even for your own personal use. Take them home, give them a try. You will love them. I'm telling you, there's no doubt in my mind. But look at these first three products, okay? So we've got the Poto Expert Orange Dry to Crack Skin. We've got the Dry to Crack Skin Blue without urea, and we've got the Dry Reddening Itching Skin. These three formulations all have the Lipo2 technology, and they all have the Barrier Expert Foam technology. You cannot go wrong deciding which one. Now they're tweaked for your patient's specific needs, and you can then choose what you think best suits your patient. So the flagship product, the Dry to Crack Skin, that's a number one seller. That's what you're going to refer most of your patients to start. It has 8% urea, and it just feels like silk when you put it on. It's absolutely glorious. I think I said that already, but again, it's so great. Just try it. The Dry to Crack Skin without urea, of course, like David and I were talking about earlier, there are going to be certain conditions where you don't want to expose urea. Like I said, that dry, thin, diabetic skin, you probably don't want to introduce urea. That could thin the skin even further. Any sort of urea sensitivity, you want to perhaps try. And you know what? Even sometimes I'll switch it up with my patients, because if they're on the Dry to Crack Skin with urea and they're using it for 5-6 months, we don't want to constantly bombarding the skin with urea. So I'll have them use a bottle of the blue for a month, just to give the skin a little break from all of that urea. The third one is the Dry Reddening Itching Skin. So there's no urea in this. It has that pyroxydolamine. Again, if you've got any sort of just inflammation, swelling, redness, athlete's foot, it works absolutely phenomenally on tinea pedis. So you really can't go wrong. I do have a lot of foot care nurses and podiatrists that tend to gravitate even more towards the red than the orange. So try the variety pack, try them, see what you like. I can go through the before and after pictures again, and there's hundreds of more like it. You just can't go wrong. So start your patients on one of those three products. Again, with the Dry Reddening Itching Skin, I would start someone who is prone to a fungal infection. So anyone with bronchidrosis, hyperhidrosis, that product would be really, really beneficial to that patient. Now, in addition to that, we've got the shoe and foot deodorant. This is an all-in-one. If you suffer from bronchidrosis, very stinky feet, it's a problem. I mean, lots of us don't, but you're buying creams for your feet, you're buying spray for your shoes, you're getting powder for your socks. It's very expensive, and it's a very embarrassing problem. This is an all-in-one. You can use it in your socks, shoes, and right on your skin, and it smells very nice. I actually honestly use it as a room spray in my very tiny clinic rooms. If somebody doesn't smell very good, spray it's so nice. And actually, I think, David, that you also have an antifungal line, and it's a special that he offers, which is the Dry Reddening Itching Foam, along with the shoe and foot deodorant and the Poto Expert Healthy Nails, which I talked about earlier, that also has that nail infusion system with that pyroxydolamine. And so when you use those three, you can sell them as an antifungal system, helps with the smell, helps with the skin, and helps with the nails. It's quite fantastic. There is a cream. Now, this does not have the Barrier Expert Foam technology. It's meant to be a mask. There are just some patients, and I'm really finding that a lot of patients with significant hyperkeratosis to the plantar surface, especially over the heels, these patients, when they go to bed at night, they want that feeling of a thick cream. They complain. They're like, well, the foam soaks in too fast. Is it doing anything? That's how fast it soaks in. That's the complaint. And so what I recommend you do is have them use the cracked heel cream at night as a mask to give them that sensation sensation of being that deeply moisturizing sensation. But in the morning, have them use the dry to crack skin with urea, just so that they're getting the benefit of that Berry Expert foam technology, so those lipids get all the way through. It substantially decreases hyperkeratotic formation. It's quite sensational. There is a foot soak. It is perfectly pH balanced. We have to be careful. I know that as medical professionals, we don't typically soak the feet, but sometimes we need to clean them. And it is perfectly pH balanced, so that when some of our patients, we have to be careful when even just using the mildest of soap, cleaning them, it can really lead to excessive dryness. This will not at all. And in fact, side note, it works amazing as an all over body wash. I have one in every shower in my house. Then we've got the callus softening spray. So the callus softening spray, again, we go back to clinical studies. Usually with callus softening sprays, they just keep upping the urea content up to 20-25%, because they think that that's going to make that reduction of that hyperkeratotic material easier. What Neuberg has done is they've actually found that they use a combination of urea, lactic acid, and allantoin. Together, these three products have a synergistic effect that allows that clinician to remove the hyperkeratotic. It's like butter. It says on the bottle to spray and wait for 3 minutes. You don't have to wait 30 seconds. It works so well. You will absolutely love it. Are there any questions that I can answer up to this point?
We're going to talk about the latest. Oh
Great
God.
ones. So Neuberg has just come out with this brand new product. It's not even available. It's being shipped to the US, I think, as of tomorrow. Anyway, it takes our regular flagship product with the 8% urea, and it has combined jasmine, musk, and rose for an absolutely phenomenal scent. Who's not going to love that? I think this is going to be the new big thing. I can't wait until we can actively promote it. You might have to wait a couple of days before it's on our website, but again, all the same issues that we've been talking about. It has the Lipo2 technology, it has the Berry Expert foam technology, and now it also has a fantastic scent. Some people don't like the scent, so give them the flagship product without scent, but some of us just love it.
Hyperhidrosis and bromohidrosis, it may help that.
Yeah. You can go to ZFT's website, www.potoexpertusa.com, and Sarah has provided all sorts of marketing materials for you that you can download, print for your patients. You also can contact her and she can make customized marketing tools for you. We really just want to make this easy for you. There's frequently question answers. We run webinars once a month where clinicians can get on, just ask us questions. How are you selling it? What are your patient responses to this? Like we just get on and we just talk. Sometimes we do fun things like fill up beakers, but it's completely complimentary. Just come to www.potoexpertusa.com and go under marketing tools, go under webinars, just access everything that we have to help you. You can also contact us if you have any questions. I know I'm always happy to answer anything I can. Make sure when you go to the site that you are using the password Zuckerman. It's case sensitive, use a capital Z. I think you say Z in the US.
Yes.
This information, I did just put it all into the webinar chat as well. So if you go to the bottom of your screen and click on chat, you'll see all these links with the ordering, the login, the download for marketing, and our next webinar on February 15th.
Absolutely. So that is the end of my presentation. Is there anything else that I can answer? Are there any questions? Please feel free, again, visit the site, send us an email, anything I can do.
Yeah, I don't know if there's any Remy users on board tonight, but if there is, they get a discount for owning the Remy laser.
That is exciting.
So
I am just going here to see if there are any unopened questions or unanswered questions, rather. Let's see here. So I don't see, nobody's typed in anything. If you do want to type in a question for David or Bree, feel free to do so now. You can always also go to the website and type in a question into the contact form, but obviously it's more fun when we have you here live, or you can unmute yourself. So I will believe I undid everybody's microphone, but I'm just going to check one more time here.
Now, don't all talk at once.
Yes, this is just getting wild.
Okay, let's just have a survey. Who thinks the Eagles are going to win the Super Bowl? How many raised their hands? How about the Kansas City Chiefs? I'm going to tell you who's going to win the Super Bowl. It's going to be the Bengals.
All right, you better put money on it.
No, I won't do that. I never would go against my Philadelphia Eagles, but the Bengals are tough team, and they've been there before last year, so we'll see. No.
All right, I'm giving everyone one last chance to ask any questions. Otherwise, we will sign off for tonight.
Sounds good.
Before I sign off, though, just a quick reminder. Next week, we have another Practice Partner Academy. It will be with Dr. Brian Markinson. We are going to be talking fungus. So who doesn't love that?
Love a good fungus.
Yes, and obviously we talked a little bit about fungus tonight. We have the, you did mention the antifungal kit with the Remy, correct, David?
I believe Bree did, of course.
Yeah.
Right. So we
such
are
a good
fungal
adjunct.
solutions.
Such a good adjunct to whatever you're
is.
using in your practice. Yeah.
It's even good without a laser. That's how good it is.
It works very well.
Works well.
Yeah.
Awesome sauce. All right. Well, I am going to let everyone get to their beds or what have you, your fireplace, or maybe if you're in Florida, you don't need any of those things, but I won't be there till next week. Hopefully I'll see some of you at FAM next week, but otherwise I will see you all next Tuesday right here for another Practice Partner Academy. Good night, you guys.
Thank you. Thanks,
Night,
Sarah.
thank you.
Good night.